HIV can affect the brain. Both the virus itself can cause damage to the brain, but also the medications to treat it can sometimes be toxic to the brain and have side effects that affect brain function and also mental health. So there's a lot of research done around the world on people with HIV, and most of it is in America and in Europe. And this kind of research suggests that cognitive problems, problems with thinking and memory, appear to be quite common, despite modern drugs allowing people to live long and healthy lives with HIV. It also suggests that issues of depression, anxiety and other problems are much more common in populations of people living with HIV than they are in other people. But not much of that work has been done in Africa, where of course the majority of people with HIV live. So in this study, called the CONNECT study, we are studying 180 people living with HIV who are from the community around us here in Gugulethu, and 60 people who don't have HIV or from a similar population. And everybody's studied for a full day. They get mental health measures, looking at different aspects of their mental health and well-being. They get detailed cognitive testing, so looking at different aspects of their thinking and memory. And they also have a lumbar puncture. So that's a needle in the lower spine to take a sample of the spinal fluid. So it gives us an impression of what's going on in the brain. South Africa has the largest population of people taking these antiretroviral drugs of any country in the world. And this is the biggest treatment change to have happened in HIV for a long time. And it's very important that we know what effect that's having on people.
It's absolutely fundamental to run a study like this in Cape Town, because healthcare is different in Cape Town to healthcare in Western Europe, North America and Australia, where traditionally a lot of HIV research and antiretroviral research has been conducted.
One really useful part of the Newton funding is the international collaboration, and having those people on board has been really useful and informative from all aspects of our study, from planning it to implementing it all the way through, and soon we'll have the data to be analysing. It's also working within the Neuroscience Institute at the UCT, and this is a really world-class modern research facility which provides fantastic facilities and opportunities to do really good world-leading research.
We were all very impressed when we came to the site. So firstly, the infrastructure at the university is state-of-the-art. The imaging facilities, the science labs to analyse the blood tests, and then going to the clinical sites and seeing where the antiretroviral rollout programs are, and next to these these antiretroviral clinics, there are designated research facilities with clinical rooms, designated space to conduct research.
Already from some of the initial results we've got from this study, we're seeing that things are very different here. And different in both ways. In some respects, actually, people's HIV is better here. The control appears better. The amount of HIV we're finding in the spinal fluid is actually less than has been found in other places, which is very reassuring and important kind of messaging to get out to people. And in other aspects, it's worse. There are many things that feed into mental health, feed into cognitive impairment, which are more prevalent in this kind of setting. The difficult lives that people live here, the impacts of social inequality and poverty. The criteria to define this problem is one that was developed in America and Europe on populations in those settings. And so we've started an initiative to define new criteria which for diverse global settings, which for the first time are being driven from Cape Town, from Southern Africa, and we've involved academics from and clinicians from across other Southern African countries, from Zambia, from Uganda, Kenya and other places.
I think the CONNECT study is really going to help us all in detailing the neuropsychiatric and cognitive aspects in a population switching antiretroviral therapy for Cape Town and South Africa, where the antiretroviral programs now contained dolutegravir, but I think it's got relevance in a much wider field and globally.
Cognitive function, people's thinking and memory can affect many aspects of their life, their ability to earn a living, to interact, to contribute to society, to raise a family. Mental health problems, of course, permeate many aspects of people's lives. And this is important, as people live much longer now with modern drugs, which is wonderful, we now need to make sure that they live well.